You're watching KTN Prime. Thank you for staying with us. Now, like any other vaccine or medicine, the Covid-19 vaccines have been expected to have side effects, most of which should be mild and tolerable. Women across different parts of the world have reported an altered menstrual cycle following the Covid-19 vaccine jab. Some women have reported early and heavier menses after the vaccination, something that has not been linked with the vaccine yet. Our Health and Science editor, Dr. Mercy Korir, explains.
A woman's monthly cycle can be disrupted by the body going through changes triggered by an infection or even a vaccine. Vaccines are known to stress the immune system, and the cycle may respond to these changes. The Oxford-AstraZeneca jab, with which more than 700,000 Kenyans have been vaccinated so far, has the risk of a rare vaccine-induced clotting disorder. 308,000, which is 44% of the vaccinees, are women. The US, which uses vaccines from Moderna and Pfizer-BioNTech, indicates that its Centers for Disease Prevention and Control, CDC, had received 32 complaints from women with altered menstrual cycle in a survey of 56,000 participants. Kenya has reported no adverse events, let alone women-specific side effects of the vaccination, though women tend to get more side effects because of having a more active immune system compared to men. The altered menstrual cycle is not only in women who have received the jab, but also those who have gotten sick following a COVID-19 infection. A study in China that looked at menstrual cycles of women who had had COVID-19 revealed that 20% had lighter menses, while another 18% had delayed menses, which they explained as a possible effect from the stress of the pandemic and contracting the virus. Even though some women have not officially reported altered or unusual menstrual cycles to the Pharmacy and Poisons Board, experts are encouraging women to do so because, so far, menstrual irregularities are not listed as side effects of the vaccine. This, experts say, if at all, is likely to be temporary with no effect on a woman's fertility, and that the benefits of the vaccination far outweigh the risks. Dr. Mercy Korir, KTN News.
Well, so Dr. Mercy Korir is here with us in studio to explain that more. And of course, we don't mean to be alarmists here. These are just reports that we are getting. Why is that the case, that we are seeing menstrual cycles altered as a result of the vaccine?
This has been conversations by various women. You can imagine that the woman's menstrual cycle really can be affected by anything, and sometimes stress. So sometimes it just takes a trigger for somebody to just recall and see, was there anything different after the vaccination? And we know that because women have a more active immune system, they're likely to get more side effects. And even younger people and those who've had COVID-19 previously are likely to have more reaction to the vaccine. So the reports that are there is either a heavier than usual flow, a delayed start, or a shorter cycle, and the flow is really heavy, according to the women that have reported this so far. And then the other rare side effects that people are reporting is a metallic or a bitter or salty taste.
This is still just women?
No, this is for everyone. And can last for a few days or until after one has taken a meal. So these are some of the other side effects that one can experience after the vaccination. Now, this is important for women because we encourage women to do breast self-examination. So because of, remember that high reactivity, because of an active immune system, they're likely to get swollen lymph nodes. So if they're doing a breast self-exam, they may feel lymph nodes. So this may be actually from the vaccine. So they can do mammogram before receiving the first dose, or wait after a month after taking the second dose, just to make sure that it's the vaccine and not actually a sign of cancer. Yes.
So then, fertility. Once we start talking about menstrual cycles, there's a concern about fertility. Should we be worried?
No, not at all. People should not be worried about fertility. This is specifically for people who are undergoing a fertility treatment, because remember, the vaccine can induce fever or, joint pain. So, and this fertility treatment sometimes involves some bit of surgery. So one may confuse that with post-surgical infections after the surgery. So it's important to wait until after the vaccine to able to continue with the fertility treatment.
Okay.
For pregnancy, there's been no worry so far with the pregnancy. It does not interfere with the implantation. But the important thing to note here is for women who are pregnant, because of the fever, just avoid brufen.
Yeah.
And anyway, generally for everyone, we're encouraging that somebody should avoid the painkillers before getting vaccinated because it may dampen your immune response.
Okay.
But then, and remember, we want to see if there's any reaction. So this is just going back to the initial report where we're saying women have a more robust immune system. So 80% of the allergic reactions to vaccine have been seen to be in women. So I think this is really just to probe and trigger women to pick their interest.
Yes.
If you experienced any difference in your menstrual cycle, it would be good to report to the Pharmacy and Poisons Board so that, you know, we can collect data, something can be seen, so that if there's anything to be looked at with the Oxford AstraZeneca vaccine, it can be looked at. Remember that this vaccine was associated with that rare clotting disorder, and here we are talking about menses, so you never really know. So it's good for women, if anyone that has taken the vaccine has experienced these changes, to actually just report to the authorities so that they can get to the bottom of it.
Dr. Masi, always a pleasure to have you here. Dr. Masi Korir is our health and science editor here at the Standard Group, and as she says, it's important to pick this. Listen to your body if you've been vaccinated and you're a woman. At this point, Dr. Masi, thank you very much. Let's speak to Dr. Nelly Bosire now. She's a consultant gynecologist. Dr. Bosire, thank you for joining us here on KTN Prime. During your work and as you go over your day-to-day work, when it involves a lot of women, are these things you have been able to pick?
Oh, well, thanks for having me. We have had, quite a number of reported incidences regarding not just the COVID-19 vaccine, but also COVID infection itself. But it's not something that we have sat down to string together and say whether it is collectible data or not, but just anecdotal reports, again, just from patients. I think for me, the earlier notifications were from women who actually got COVID-19 infection. And in the course of the infection, during the few days that they are out, I've had 2 or 3 of my patients call in to request for advice on what to do. I am in isolation, I am having COVID-19, and my periods just started, and I have never had, this kind of periods. And not just that the periods are heavy, but also the periods are painful, extremely painful, much more than usual. So, you basically don't quite think about linking them much, but then it has become a trend. We've also had a few who have reported, even amongst our own female doctor colleagues, there are a few who have noted that after receiving their vaccine, they really did get quite severe reactions. A lot of people who have had the vaccine have actually been put to bed for, even if it's just 24 to 48 hours. And one of the things that occasionally even some of our own colleagues have reported is periods that were just not the usual. They were too painful, they were too heavy, or they did not come at the expected time, either a little too early or they were delayed. And in the situation in which they were delayed, there was a lot of pain before the actual onset of the period.
Yes, so you mentioned a delay, heavy and painful periods. But is it related to any age group? Talk to us about that. What are some of the distinct characteristics of this?
Well, there hasn't been a specific age group. I think for me, I've at least had reports from some of my patients ranging across all ages, but mostly in their 30s, all the way to the postmenopausal women. I've had a few reports of women who are past menopause, who are above the age of 58, who got their vaccines, and they actually did report cramping, like severe abdominal cramping that felt like they felt when they had period pains in their adolescence. And it was quite marked. But the challenge we have is that in Kenya, we may have a reporting system to Pharmacy and Poisons Board, but this information is not accessible to Mwananchi. So even those who have had adverse reactions to the vaccine as expected, the fever, the joint pains, the malaise and all that, very few people are doing formal reports. So you can imagine how much more difficult it is for women in their 60s who are currently out there in the counties receiving these vaccines to have a system of reporting and saying these were my symptoms. So, you know, it's just reports of where somebody calls you up and say, hey, Dr. My mom just got this vaccine and this is what she is noting. Is this expected? Is it normal? And so you hear it once and you think it's really not a big deal. Maybe it's just something different and that the vaccine is just a red herring. Then, you know, 2, 3, 4 people and you begin to wonder whether there could be a trend. We don't have any data right now to correlate, say that this is a trend. We probably need to pick this up. We need the Pharmacy and Poisons Board to make it simple to report side effects so that then they can be able to list this and we can begin to see if independently women are reporting this rather than us prompting them that are you having this reaction so that then we can list or not, because women's periods are women's periods. They're as indeterminate as they get, and even the woman with a regular period can wake up and have an irregular period, but just because it coincided with the vaccine time, then they would probably presume it's because of the vaccine. We still do not have hard and fast evidence, so but we need to keep getting these reports so that independently we are able to collect data that can withstand, you know, data strength.
Dr. Are there any dangers to this? Is there a cause for alarm?
I do not think we have any cause for alarm. Not at all. We have no information. We have no evidence that there is any cause for alarm. And one thing we need to be very wary about is that this is Kenya. We have had a lot of issues with mass vaccination programs where we have really had this issue of female fertility being used to discourage women from taking these vaccines. So where we sit right now, this is not something at all that we would like to encourage. There hasn't been any evidence that these vaccines can lead to any fertility problems. And just having menstrual irregularities doesn't necessarily translate to calling it a fertility problem. Also, more importantly, is that a lot of the women that I have heard from, even the ones who suffered from COVID and had issues with their period, it was really a one-off affair. It's not something that has now persisted after. And this is patients from maybe we've seen for several months, or somebody had COVID last year, and they had period pains, period issues during the actual infection, but subsequently after, the body is back to normal. So it could be a one-off. And remember that any infection to the body is a stress factor to the body. That alone is enough to cause a lot of issues, especially for women who are very sensitive, to have hormonal issues that could lead to irregular periods. The vaccine itself, for those that it triggers adverse reactions, is quite stressful. There's a lot of pain and headache and muscle pains and, chills and rigors. And so it's also a stress to the body, and that alone can have an effect on the immediate current cycle, but doesn't necessarily translate to the long term. So no, we do not have any evidence whatsoever to cause any alarm at all.
Exactly. All right, great. Are there any other side effects that are specific to women that you've noted in your line of work?
Not at all, but we probably have seen that women tend to get more severe adverse reactions, maybe compared to men overall, but that's not a hard and fast rule. Again, as I said, we're not having proper reporting systems. People are getting vaccinated out there, but there's no information telling them that if you have any of these adverse effects, this is how to report. Maybe we need to start seeing the Ministry of Health being a bit more clear, use an SMS short code, tell people if you have these symptoms, send an SMS on this code, give your name, ID number, and say what side effects that you are having. That way, then the ministry is able to track. But right now, people know you're supposed to report, but who knows to report where, through what means? So it's really difficult for us to say that Kenya as a country, we are collecting objective information about the adverse effects that are as a result of this vaccine.
Dr. Basire, so going forward, and I'm glad you mentioned the issue of, a proper reporting system. 700,000 people or Kenyans have been vaccinated so far since March 5th when the first person was vaccinated. What else should we be on the lookout for?
Well, a lot going to take a long time for us to know. And the beauty about the vaccines that we're dealing with now, we're literally vaccinating the entire world at the same time. This really gives a lot of opportunity for substantive data collection to be able to tell us what do we need to look out for. There's a lot we cannot tell in terms of the long term. We know that vaccines, for instance, that we have been using have taken 20, 25 years to develop, test, come up with side effects and all these and be able to know where we are. We have only had 1 year. It's interesting that even the test subjects for the initial Moderna and Pfizer vaccines that were already being tested on test subjects, these test subjects are receiving their 3rd dose of these vaccines now through the months of March and April going forward. It's a very short time for us to be able to say much. So all we want to say is we are all learning together. We're all going to see these things together. We need robust reporting systems so that by the time we're making recommendations, it's really based on hard data and not just anecdotal evidence or, standalone reports that we're hearing. It doesn't mean that we're dismissing these reports, but we need them to be handled in a manner that then we can be able to use that information to objectively say that we think this is an issue or this is not an issue. But one of the most important things going forward is that let's not be alarmist. Let's not panic. Vaccines have been there years immemorial. We have had vaccines. We are not starting afresh. And we've had vaccines that some of them have even more severe side effects than what we are seeing now with our COVID-19 vaccine. Just take an example of the vaccines we give children at the 6, 10, and 14 weeks. We've always known that the whooping cough component of that injection is very painful. And babies will cry for 2-3 days. It's just their manifestation of what adults are feeling now with the COVID-19 vaccines.
Great.
So let's not blow this out of proportion.
Great. Thank you. It's very important that you put that across so that next time one is asked to go and take a vaccine, they won't say that they had that there are a lot of side effects. But thank you, Dr. Nelly Busire, for joining us here on KTN Prime. Dr. Busire is a consultant gynecologist, just putting that issue into perspective for us. Studies will be made and we'll be sure to keep an eye on that particular story. I want us to take a quick break.